I'm Lee Kelso. Glad you found us here on HealthCall Live Online, where we offer extended interviews with guests featured in our weekly radio broadcast, the HealthCall Live Radio Hour. Today, we're going to dig into and understand the concept of inflammaging. That's the combination of inflammation and how it affects the aging process, linking several different conditions, diseases, and even premature death. So let's jump out right now to the National Institutes on Aging and meet our guest, Dr. Luigi Ferrucci. And I would like to have welcome you to the program, of course, but help me understand a little better this big picture concept of inflammaging.
Thank you very much for inviting me, Lee. I'm glad to talk about this topic. It's one of the topics that I've studied the most over the last 2 decades. So 2 decades ago, we started discovering that in many older people, we found a high level of pro-inflammatory markers into their blood. You know, the quintessence of them are two of them, which one is called interleukin 6 and the other is called C-reactive proteins. And that even when we selected the very, very old subpopulation and very, very healthy subpopulation, this phenomenon was still there, and we couldn't really understand it. And then we started studying it. We found that those individuals with higher level of these pro-inflammatory markers, had higher risk of developing a number of health outcomes, myocardial infarction, stroke, also to develop the disease and the condition that are typical of aging, such as frailty and disability. And so we started studying, what is the mechanism that lead there. And one of the peculiar things that this is not an inflammation that comes from bacteria or viruses. This is an inflammation that comes from some degradation occur in our body through multiple mechanisms. And so in a way, inflammation is telling us how much damage is there, and much of this damage cannot be repaired and is revealed by this reaction of the individual that create inflammation. And in the inflammation is positive in a way that we use that to fight bacteria, to repair, when we have a trauma or a cut, we need the inflammation to repair those. So we can't live it without inflammation. But when the inflammation is prolonged over time, has a lot of negative consequences. And that's what's happening here. That doesn't have something that need to be resolved, stay there for a long time, and you have negative consequences of it. I can expand on why, but I wonder whether there's any specific aspect that you want to know about.
Well, what I want to do now is kind of walk through some of the conditions that we think are associated with inflammation. So on the screen right now is a graphic that you produced that shows everything from cardiovascular disease to diabetes to chronic kidney disease, cancer, depression, dementia, osteoporosis, muscle loss, anemia, a number of different conditions you believe are associated, or is it caused by inflammation?
Well, I think that you frame the question exactly in the right way. So we know that there is association. We know that those with inflammation tend to develop this disease more frequently than others that do not have this inflammation in their blood. But the exact mechanism that link them is not known. For the evidence we have, there is probably a causal role in cardiovascular disease because as we block inflammation, with a specific type of monoclonal antibody, we see that we can substantially reduce the risk of developing cardiovascular disease. In other instances, this evidence have not been gathered, so we're not sure. In part, it's because the trials have not been done for other conditions. And one of these conditions that people are focusing now is the role of inflammation in dementia. they start realizing that not only the peripheral inflammation that I was talking about, but the inflammation in some of the inflammatory cells, the microglia that is in the brain, is present in people who develop neurocognitive problem and neurodegenerative disease, including dementia. And so there's a lot of observation, a lot of studies and research that is done to understand that.
Yeah, that
So,
is interesting. So, inflammation as a root cause of dementia. So, obviously, you're talking about inflammation that we've lived with for years and years and years with a cumulative impact on our brains.
the suspect that there was some sort of correlation, it really has a root that is 3 decades old, 30 years old, because like 3 or 4 years ago, well, a number of epidemiological studies that showed that people that have been taking anti-inflammatory drug for a long time, for a very long period, tended to have a lower rate of development of inflammation, but also of dementia and cognitive decline. And
So, should
so,
we? So, does that imply then
uh,
that
that,
does that imply that
that
we should be taking, all of us should be taking anti-inflammatory
it,
drugs?
it, it doesn't, because, as I said, these are observational studies. We need to do the studies where we select people, we treat them with an anti-inflammatory drug of a placebo, and we see whether those taking the anti-inflammatory drugs, are really have a less risk of developing dementia. So we need to wait the science before we make any action. But I'd say that there is some indication that that may be possible, and that justify us to run this randomized control trial that tests this hypothesis. Maybe, I want to say maybe in the future, we may discover that taking some specific anti-inflammatory drug may protect us from, problems that develop in the brain.
We're going to come around and talk about your beliefs on how we can live with less inflammation. What can we do about that in a moment? But I want to touch now on the concept of senescent cells. And I'm going to take a stab at describing this in a very general term, and then let's go a little deeper. I associate senescent cells with that one house on the block that is falling down. It's not properly maintained. It is just in decay. And over time, for lack of a better word, the funk from that house kind of spreads through the neighborhood and brings everybody's house down. Is that a good metaphor?
That's part of it. I would say that's really part
Okay.
of it.
So tell
I
me
think
more
that
about.
to use your analogy, senescence is the mechanism by which when the house starts falling apart, and there is a sensor within the house that feel that the stability of the house is threatened. The house decide to stop this process because this may endanger the entire neighborhood or the entire city. So the cell go in what we call arrest of replication. In particular, this is true in the field of cancer. A cell that have genomic instability, whose genome seem to be damaged, may evolve into a cell that originate cancer. Instead of doing that, decided that they will not replicate anymore. They will stay there for a long time. The problem is that that cell start producing a number of mediators. Most of them are inflammatory mediators. The IL-6 that I was telling you before, the interleukin-6, is one of these mediators. And we think that they start producing these mediators because they call from the immunity to eliminate that cell, so that threat can be eliminated. But in some cases, this call to action is not effective. And so the cell remain there. And all these, what we call the senescent-associated inflammatory proteins and other substances involve the other cells that are in the surrounding, infect in some way the homes of the neighborhood that you were describing,
Yeah,
and
so
so
that's
that
the funk
spread
that
out.
spreads, right? That's the funk that spreads out around everywhere. Are those
Yeah,
inflammatory markers, the cytokines, the IL-6, that stuff you just
yeah.
mentioned? Yeah. Okay.
Well, one of the peculiarities of this is that for a reason that we don't completely understand, this cell becomes somewhat immortal. They are become unable to commit suicide. You know that in each cell there is a program that can be activated that's called apoptosis. They
Hmm.
make the cell become suicidal. And this suicide eliminates the cell, but will preserve the health of the individual. Well, these cells cannot commit suicide. And that's a bad thing because if they could commit suicide, we could eliminate them. And eliminating them will eliminate, the bad consequence, including the inflammaging. And there are drugs that are now being in development and in the pipeline. Some of them was even in clinical trial that try exactly to do that. So they make those cells again able to commit suicide, to commit apoptosis. And then they eliminate these cells. Well, in animal models, and I need to make sure that we understand that these are not human, but in animal models, the elimination of those cells slow down many of the features of aging. Slow down cataract, slow down osteoporosis, slow down the decline of muscle mass. Whether this is going to happen in humans or not, we don't know yet, but there is incredible interest and active research in this direction, not only from the academic institution, NIH, in our group, but it's starting to percolating into industry. Because as you can imagine, if we could develop drug that can do that, and you don't have to take them for a long time. You can have a cycle, every 2-3 months, eliminate these senescent cells, and then avoid the negative consequence of them. So it may be a dream come true, but to me, is the light of the horizon that we need to look at.
So, I like to keep things simple. What you've described to me is kind of like a dose of weed killer that,
Yes.
that we knock out the bad things and then they kind of grow back and you apply a little more a little bit later.
Yeah, and then the beauty of it, and I will have to be very cautious here. Some of these substances are natural compounds. They are extract from plants.
Huh.
They are, found in some specific food. I don't want to be more specific, but I don't want people now, go crazy and start taking those supplements because we don't know the evidence in human yet. But I will just say that, open your heart because there's something at the horizon that seems to be very promising.
Well, that's exciting. So, as we look forward, then um, you see a class of medications that might be forthcoming that would eliminate those senescent cells, and then the effect would be what? Do we live longer or live healthier
Well, that's
longer?
very, very interesting observation because in the animal model, mostly in mice, the elimination of senescent cells, in this case through a genetic engineering trick, it reduces the emergence of the chronic disease, reduce the cataract, the osteoporosis, the sarcopenia. It does not increase longevity, or does not increase longevity very much, very, very teeny tiny amount. So that means we will live the same amount of time if this could be translated to human. And of course, we should be extremely cautious to do that because sometimes what we discover in animal doesn't really fit what we find in human. But so what we call health expectancy. So
Hmm.
we will live more of our life healthy, being able to enjoy everything that life has to offer to you, and then have a very, very smaller and smaller and more period in the end of life where we develop disease, which is closer to our death, which if you ask all the people, that is exactly what they want. I don't think people want to live forever. Everybody's frightened by becoming disabled and dependent on others. And
Sure.
that that's where we can go, I think.
So, you've described a situation in which I'm healthy for most of my life. I get to the end of my life and I sort of just fall off the cliff instead of have a long, slow, painful decline.
Yeah.
That's very attractive.
Yeah, dying with the boots on,
Yeah,
in Texas, I would say.
exactly. Yeah, that would be a
You are on
fantastic
a
outcome.
horse that at some point should drop down.
Uh,
And I mean, it's a tragic event because dying is always a tragic event. But, I will choose that for myself, for sure.
I would choose that for myself as well. So, we know that there are foods that are associated with inflammation, and
Yes,
that the constant presence of insulin in our body contributes to inflammation.
yes.
What are those lifestyle factors that you think that we can modify to reduce our systemic inflammation?
Yeah, thank you for asking that question because everybody think that promoting health in old age need to be esoteric. It's not. There is many, many simple things that we can do now to really reduce substantially, the burden of aging. First, if you're smoking, stop immediately. There is nothing worse than that. Second, if you're overweight, try to lose weight or to maintain your weight, not to increase your weight, because those senescent cells tend to accumulate in visceral fat. So if you're not accumulating fat, those senescent cells will not be there.
And let me just take a moment and clarify.
Yes,
Visceral fat is the fat that forms on the inside of our abdomens and surrounds
yes,
the organs. This is not the fat that you can pinch on the outside of your stomach.
exactly,
Right.
exactly.
And it's
Think
very
about,
hormonally active. It has
yes,
yes, it's very chemically active fat.
produce all sort of negative stuff that
Right.
have a negative effect on the body. So when the fat accumulate where it is supposed to accumulate, which is subcutaneous compartment, we know that it's not even a cardiovascular risk. Well, when the fat accumulate in the abdomen, around the pericardium, within the muscle, that's where is the fat that really increase insulin resistance, develop, contribute to the development of late life diabetes, type 2 diabetes.
Hmm.
So that's what we need to avoid.
Okay, so
The
we need
second,
to.
the third thing, I
Thank you.
want to say the third thing because it's really important. Exercise is the best pill you can get ever. And and also I want to, say you don't have to jog 45 minutes every morning. The real difference in terms of mortality, the real difference in terms of risk of chronic disease occur between being sedentary and walking 10 minutes per day. Those 10 minutes are magic, the magic oil that you put in the machine of your body. Don't underestimate them because the difference between 0 and 10 minutes may be a really big risk in terms of health outcome. Of course, if you exercise more, it's better.
Hmm.
You get a little bit better. But the big jump is between being sedentary and walking 10 or 15 minutes per day. Those
Just
10 to 15
15
minutes,
minutes. 15
yeah,
minutes?
15 minutes make already a difference. Don't think that, oh, I can walk an hour, so I walk zero. No, walk 15 minutes because those 15 minutes are really, really healthy for you.
Okay. So tell me more. I'm sure that you exercise regularly. I'm confident you don't smoke. Tell
I
me about
don't
more
smoke.
changes you've made in your life because of what you've learned in your research.
I mean, I think that I'm pretty health conscious, but not 100%. For example, I exercise. That's the first thing I do in the morning. I get up at 5:30 and I try to run, 80 to 100 miles per month. That is my goal.
Okay.
So I try to maintain my weight and exercising, hopefully, improve that. But although I'm Italian, I try to curtail a little bit on carbohydrate. I can't really live without pasta, but I eat pasta a couple of times a week, not every day, and that really works. I go there regular to the preventive, to the doctor, so to see
Hmm.
whether I am healthy. I
Hmm.
control my blood pressure, and so far, thanks God that their blood pressure is okay. Um, the other thing I don't do, I am a workaholic. I love my job tremendously. This has given me enormous pleasure to discover. I started being interested in aging when I was 15 years old. I cannot tell you how old I am, but much older than 15. And 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 uh, and so I work 14 hours a day, and I don't sleep enough. I mean, if I would think about one thing that I should do and I don't in order to be healthier, is to sleep at least 7 hours per night. That's
Sleep is
really a
so
very,
critical.
very important, very,
Yeah,
very critical. People underestimate it.
it is. I agree. So tell me more about any supplements that you take. Do you take antioxidants? Are you taking,
I
the
take
the
nothing,
nothing?
nothing, because there is absolutely no evidence that is solid that those supplements have any effect on your health. I try to take nothing. I avoid everything that is chemicals. I don't eat stuff that is in a box. I don't eat stuff that is in a can. I don't. I try to avoid to put in my body a substance that I don't know what effect may have. But I don't take any supplement.
That is prudent.
One thing that the best supplement you can get is water. We don't drink enough. So
Hmm.
think about 1.5 liters of pure, good water every day. I think is going to make so much more effective than any supplement. There's some evidence now, for example, that alkaline water seems to be effective to reduce inflammation. There's one trial that was effective. It's not been confirmed, but the data are compelling, and what can be wrong with water? That's
What can be
the
wrong?
other thing.
Let me push you in a direction of some controversy here, and that is there's growing evidence that calorie restriction augmented by metformin, the diabetes medication, is quite helpful in not only controlling weight but also reducing inflammation. What's your thinking on that?
So, I mean, the evidence in animal model for calorie restriction is overwhelming. That if you put the mouse on 25% restriction of calories, you prolong their life substantially. And even if you do a little bit less, like 10%, it really is miraculous. So that in low level animal works very well. If you go to a more, higher in the phylogenetic scale, think about non-human primates or monkeys. The calorie restriction has been controversial. There are positive studies and negative studies. And the only study that have been done that in humans is the calorie, which was a study of 25% calorie restriction for 2 years that show some beneficial effect, but not extraordinarily beneficial effect.
Okay.
And people are still working on that. There is an active project from NIH to do a much larger trial. But one thing I want to say is that there's a new line of evidence. And I don't want to go to the metformin. A trial will be done, in the TAME trial will be done. And Nir Barzilai is leading this fantastic group of scientists that will show whether this is true or not. It's been done with all the charismas of the FDA, the FDA approved it. And when we have the data, we'll discuss that. Hopefully it will work. There are some the biology of it, which I don't want to go into because are details, but the biology of it is fascinating. Metformin is a drug that really hit on one of the fundamental mechanisms of our energy regulation. So it may work. But the time-restricted feeding is becoming, is driving our attention. It seems to be that, it is important, how much calories or what you eat. It's very important how much you allow your body to process those calories without being constantly overwhelmed by food. It has been demonstrated that the typical American eat 18 hours per day, or between 18 and 19 hours per day, because we do, our little snack before going to bed, and we have breakfast immediately after we get up. And there is evidence that restricting this time may be beneficial. I'd say that the evidence is not solid, but there's a number of studies that are ongoing. I'll give you just circumstantial event. I was a couple of years ago in a meeting where they were talking about dietary intervention. And one of the speakers was a middle-aged dietitian from England that woke up and got up to the podium and said, I've been working for 40 years in this field, and I've been incredibly depressed because every time I am successful in people losing weight, when they come back 2 years later, they always have regained their weight. And so this is such a frustrating situation until I started doing calorie restriction in my patients. And when I did the dietary restriction in terms of time dietary restriction, I started seeing not only, good result, not the losing of 40 pounds, but what they were losing, they were maintaining, because it's easier to do and it's much more behaviorally acceptable. Maybe it's hitting on some biological phenomenon that is important. So in a way, I think that we may go away from the pure calorie restriction and understand that, the circadian cycle also need to be part of the game.
Good point. I'm doing a 16/8 fast, so don't eat anything after dinner in the evening, and then go 18 hours until breakfast. And I have no trouble. It doesn't bother me at all. My wife, on the other hand, is one of those people who can't go very long without some sort of a snack. She just says she is starving, and so I do think that you have to. It's everybody's own metabolism. You find your set points, right?
Yes, it's also true that you adapt. I'm sure that in the first few days, it was more difficult, but now you're accustomed to it. So in a way, your body adapts to it. I do 1 day of fasting every week. It was very difficult at the beginning. Now I feel like I couldn't live without it.
Oh, isn't that great? Well, we've run out of time here. I very much enjoyed talking with you. I'd like to revisit this topic and connect with you again down the road. Give me just, if you could, give me your best advice to someone who is interested in improving their health span. If you could do that in just 30 seconds or so.
Health span, live longer.
Yes.
My best advice will be select parents that have been living longer. Oh. That is the strongest predictor of being able to live longer. Of course, you cannot do that, but
right.
The only scientific advice that I can really give you for longevity.
Okay, so let's shift away from longevity to health span.
Well, health span, there is a lot you can do. There's a lot. First of all, we talk about aging from 65. That is being a really big mistake, because what is happening to us in old age, we do know now that is conditioned about what we do in our first period of life. What we do in our 21st years of life. So I think that if you want to improve the longevity of your children, educate them about the health behaviors early in life. Because you can gain something later on, but not as much as you will gain by starting early in this path. And this is because we have resilient strategies. We can deal with the damage accumulation. But this resilient reserve is not, without limits. So if you consume that in young age, you will not have that for you in old age. The other thing I will tell you before, I think that exercise is the intervention that can give you the best, result for your body. Even small, more if you can, but And again, that is also, you need to know that at the beginning it may be difficult to accept. Your body doesn't want to because it's kind of lazy. But then as your machine start running, you will find that exercise become easier and easier and then become pleasant. You know, the endorphin that's being secreted. And so exercise become a pleasurable component of your day. I think that is the best advice I can give you today.
Well, thank you so very much. I appreciate your time and all your experience sharing that with us today. Dr. Luigi Ferrucci from the National Institutes on Aging. I hope to talk with you again.
Thank you. Have a great day.